My name is Dr. Crystal Blade Mathers, and I am a pharmacist. And today I'm just going to share a little bit with you about how I became a pharmacist and what that means to me, as well as how, if you're interested, you can also be a pharmacist as well. I first became interested in pharmacy as a child, where I would help my grandfather, who was a diabetic, and he had several medications that he was taking. I would help put his pills in a pill box as well as give him his insulin. And it was that point on that I began thinking and being curious about how these drugs work in the body. And I first became fascinated with the fact that they were keeping him alive and keeping him well. And that's when I officially decided that I wanted to be a pharmacist. So, what is a pharmacist? So, pharmacists are responsible for ensuring high quality medications are given to the patient. We also give the patient advice on their prescriptions, telling them how and when to take them, as well as any potential side effects and any food or drink or supplements that they should avoid that may interact with the medications. And we are also advising healthcare professionals about the best practice and safety and the best way to use the medication. The majority of my career, I've been in independent compound pharmacy. In independent pharmacy, you also have your counting of tablets, filling prescriptions, counseling patients, and verifying medications. But you also have additional services like compounding.
So what is compounding? Compounding is the mixing, combining, and altering ingredients to create a medication tailored for an individual patient.
All compounding starts with a powder where you mix it up, and then from using that powder, you can either make ointments, creams, or gels, as well as capsules. And many other formulations. It just depends on what the patient needs. I just want to emphasize that that's just one type of pharmacy, but there's several other settings that pharmacists are a part of. They work in hospitals also as a clinical pharmacist, where they round with doctors. You have academics where they teach, clinical research, and industry, which involves pharmaceutical sales. There's several different settings that pharmacists are a part of. So you may be asking yourself, how much does a pharmacist make? This is data from 2019, and pharmacists on average make about $125,000 a year. But I will tell you, this is changing as the industry is changing. Right now, there's an overage in pharmacists. So that is something to think about when going into this field. It will change eventually, but right now there is a overage of pharmacists. What does it take to become a pharmacist? If you're interested in pharmacy, this is the perfect time, being in middle school, to pursue this career. You want to make sure you have good grades. And as you move into high school, you want to also continue to have good grades and get in extracurricular activities, because it can be competitive. So you want to make sure you stand out. And from there, you would go to college and do pre-pharmacy work or obtain a degree. Most programs now do require a degree. And you'll do your 4 years of pharmacy school, and then from there you'll be a pharmacist. And again, there's many opportunities within pharmacy outside of the community setting. There's the hospital, PBM, research, academics, managed care, and several others.
So I hope you found this presentation helpful. If you guys have any questions, feel free to email me. My email is clblade@gmail.com. Thank you for your time and happy holidays.